We just passed the $21 trillion debt that President Trump and the Congress is facing. And thank goodness, and I'll say this, and I have to give President Donald Trump credit, he is leading. And if you look at what's going on in the economy right now with unemployment being at its lowest level, 3.9% in about the last 25, 30 years. And you look at, and that's for all categories too, women as well as African Americans, as Hispanics, all of that is down. Unemployment is down, and jobs are being created. Now, and the magnificent things that he is bringing about with this open door policy of not being afraid to negotiate and recognizing that we have to negotiate with strength. I really have to say I admire how he has addressed all of these issues. And I think June's watched it with me. And I know that he has a unique style. And does that mean I like everything that Donald Trump says or does? I don't like everything that Matt Bevin says or does. But they don't like everything I would say or do.
Nor do I.
Nor does June. So, but there's no such thing as a free lunch. Everybody somewhere is paying for that lunch.
Free is not free.
Free is not free.
Right.
And you have to be brave enough and realistic enough to do what you're trying to do down there, and that is stand up and say, okay, we got this problem, how do we begin to solve it? And you all have done that.
You're right, and we need to work within reality. And that's what we have done. You know, we've taken a hard look at all of these numbers, and the numbers are real. It's real dollars. It really affects, you know, what we can, like I said earlier, the services that we can provide as a state. And, you know, so part of creating this budget and paying down the pension, and it'll take time, and the reasons why some of this was so difficult is that we don't have the revenue coming in. Now, last year we put some really good legislation in place. We passed some great legislation, right to work, prevailing wage, some things that really made us a more business-friendly state, and we need to continue doing that. We've passed workers' comp, and we've done some really good things that are attracting businesses in higher numbers than in any recent history.
And the Commonwealth has taken a big, you know, we had a sledgehammer hit our economy.
Yeah, we did.
And the sledgehammer that hit our economy basically was coal going down. That's coming back up somewhat now, but nothing the way it was at one time.
Right.
And then tobacco. What farmer hasn't been affected by?
Right.
And maybe rightfully so. I don't smoke anymore. Used to chew tobacco and smoke the pipe. June used to smoke, and then she started teaching non-smoking classes.
Right.
You know, times have changed, the things have changed because health has demanded.
Well, I mean, you know, research is a good thing. We understand more what the health effects are of smoking, and honestly, we didn't know that 50 years ago. So,
and with finding out all those things, your economy though is affected when a big part of your economic situation was with tobacco. Dependent on that money's gone, so you have to find new revenue, new avenues of revenue. And I admire you for trying to do that down there, and for you teachers out there and administrators, I am very proud of you. I had 2 sisters that taught, about 7 aunts and uncles that taught.
We have 3 nieces who teach.
And we have 3 nieces right now teaching.
right.
And we need to get our national priorities together. I mean, we pay athletes these outrageous figures, and we pay some of these CEOs outrageous figures, and some of these superintendents are making outrageous figures, to be quite honest with you. And when you compare to what a teacher's making, and we have a little too much double dipping in some of our systems, a little too large of bureaucracies in all of our governmental systems that need to be examined. When you have for instance, one time I had a federal grant teaching all of the community action agency workers across the state of Kentucky how to weatherize homes. And I did all that across the state, and somebody said, well, John, you got to renew your grant. And I said, what for? I've finished all the counties in the state. Why should I renew my grant? Well, you're gonna lose everybody's job if you don't. Well, there's a time to say no to things, it's a time to stop, and it's time to turn something into doing something else that's different. So we have to hold our government officials accountable. And that isn't easy, because when I was with Congressman Breckinridge in Washington, the first thing he taught me was, John, don't get Potomac fever. I said, what's Potomac fever, sir? And he said, well, they come up here and they pick you up and show you around town, and all of a sudden you meet all these bureaucracies. Just remember, they'll look at you and they'll say, you're gone in 2 years, we're here for a lifetime. And that's a very important thing for elected officials.
Right.
And stand behind your elected officials when they do try to do things to organize and implement and do things to cut costs. Because
Right.
they are the voice of the people.
Well, that's right, and you know, that, to your point in relating that to the pensions and the double dipping, or the spiking, if you will, of retirements, that was another area that we looked at, and believe me, we looked at all of these areas, and some folks couldn't live with all the changes that we wanted to make. Because, you know, they're very used to receiving these benefits, and it is part of their pay, because they didn't get salary increases. But we did address the sick days, and so the teachers now will continue to get paid for their sick days, but they can't spike their retirement. They can't save them up to spike their retirement at the end. And that's something that created, you know, just a huge cost for the state, and it really isn't fair. I mean, no one else gets to do that. You know, we use our sick days when we need them, and not that we want to encourage people to use sick days, but I think you know, as public servants and as any employee, really, we need to do the right thing. And so, you know, it's another bit that we handled. It wasn't popular, and it still isn't popular, but, you know, I think that it's one small, that was the only change that we really made to the, well, not to the current retirees,
Right.
but to the current employees, and change some of the time that you have to serve for your retirement.
Well, one of the things that you pointed out earlier that's very important for the public to know, school teachers do not receive, if they're vested in their retirement plan, but it takes 10 years to get vested.
It does.
And you are actually, if you're less than that, you can't take advantage of the retirement plan, and you lose those years on Social Security also. And so that's a real catch-22 there that needs to be looked at eventually.
Right.
Somehow, because.
Well, I think utilizing the hybrid cash balance plan, that is a portable plan. And so, you know, from day one, you own the plan. You can take it with you. So I think that, you know, for the new hires, that's not going to be an issue, but.
And it's fair, because they know, they see what it is when they're hiring in. So that when they make the decision, it's not a pig in a poke.
No, it's not a promise that we're gonna make some change about.
Right.
And, so, you know, I do really feel for the teachers who have been in just under 10 years and aren't fully vested and can't take advantage, because, you know, they are bound by this contract, and it's something, as you said, it was set up long before I got there, and, you know, I've gotten up to speed on all of this, but it's a difficult process
Well, you're doing
really
a magnificent,
understand.
we're proud of you. I'm proud of you.
Thanks. It's been very good.
And aren't we really proud of our classroom teachers? We are.
I was gonna
Oh my
say.
gosh, they work, you know, much longer hours than anyone gives them
No
credit
one knows
for.
it.
No one
Gee.
understands really what they do, and, you know, it's, I mean, they take on such an important role. There's so many families who are struggling in so many ways, and we do ask our teachers to do a lot.
A tremendous amount.
Yeah, and so I hate to ask them to do anything else, but, you know, a lot of times, and it's another reason why we really need to support the teachers and education. And which I'll say, in this budget, we fully funded education. We funded education at a higher level than in any recent history. SEEK funding is the highest level that it's ever been funded. So, you know, we are paying attention to the fact that the teachers and the education system as a whole needs to be supported. And, you know, so it's funding, but it's also regulations, and it's, you know, allowing for creativity in classrooms. I trust the teachers to teach our children and do a good job, but we need to, of course we need standards in place, but
Right.
and guidelines, but really let's let the teachers teach.
Well, I think that's magnificent with the way you're working with that. Now, where have you been?
Mhm.
What are you seeking? You're seeking quality,
I am.
and where are you going? What do you see for the future of not just education, but
Mhm.
our government in Kentucky and
Our
working
state.
with the legislature?
Right.
What,
Well, I mean, I think, of course, I'm a Republican, and so I think it's a good thing that we are in the majority, because we are putting some really practical legislation in place that's making a difference. It's boosting our economy. We've been able to bring in, since we passed all of the right to work and prevailing wage and some of these really business-friendly pieces of legislation, we've brought in over $10 billion in new economic development. Those are new businesses, those are new jobs in Kentucky, and so that's a great thing. So I think that it's very important to pay attention to the business friendliness of our state. And the tax reforms that we put in place, we reduced our personal income taxes as Kentuckians from 6% to 5%, and we broadened the base of the consumption tax. And if you look at Tennessee and Indiana, Texas, Florida, some of the states who are moving to a more consumption-based tax, they are thriving. And we're getting the personal income tax down. And so this was really phase one of probably a 6 to 7, 8 year project to reduce the personal income tax even lower in Kentucky and broaden the base of the sales tax or the consumption tax. Because I think it's important that we pay for what we use. And I think that's really, that is what this does. Now, this also moved us, the nonprofit tax foundation they look at all of the states and the tax situations in states, and this moved us from 33rd most competitive in the nation to 18th.
Wow.
That is huge.
That is huge.
I mean, and so our credit rating is going up, and we will start attracting businesses. So I think that is a really important big picture issue that we need to pay attention to. We have healthcare issues, and that's my background, and it's my area of expertise. We have this drug issue, and we have got to look at all avenues to really control this. So what I like to say is, I mean, we have a horrendous problem. We are losing about 60,000 people nationwide to addiction.
I'm glad you're
and
bringing this up, because
overdoses.
that is so important to let people be aware of that.
Right.
We personally, it has touched us not directly but indirectly. John's son's friend's son, just 17 years old, and he was doing well in school, a great kid. And the next thing we know, we get a phone call and hear that he had overdosed. We're like,
It's heartbreaking.
it is unbelievable. And
It really is.
A friend of mine, her nephew, her only nephew, was exceedingly well in college, was playing football.
Right.
Found him to drug overdose. Their family had no idea.
It's just devastating.
It's touching everybody's life.
Yes, it is. And that's, I mean, it really knows no boundaries.
That's right.
It cuts across all demographics.
That's
It doesn't, addiction just doesn't care where you went to school or where you live or how much money you make. It touches everyone. And so, we have a fire that we need to put out. We are losing people, and we need treatment, and we need best practices. We passed some legislation actually that, last year I passed House Bill 333 that caps opioid prescriptions at 3 days for acute pain, because we know that we have a prescribing problem. No, I mean, if a patient has true pain, chronic pain, hospice, cancer, trauma, surgery, they can still get their meds, but we just wanted to press that pause button and say, is this really medically necessary?
Yeah.
And so I'm working with the cabinet
wonderful.
then and MCOs. I'm meeting with an MCO right after this. I'm heading to Louisville, and we're gonna talk about things that affect treatment, and things like the payment for treatment, and prior authorization, things that insurance companies are doing to save money, but it's affecting patient care. And so I think it's really important to, just a shameless plug, to have someone in the healthcare business
Oh,
or with a
absolutely.
background in the legislature to understand these really
That's
impactful
wonderful.
situations. I mean, it's, there are so many great people in the legislation, and everyone brings their own gifts and their talents and their expertise and experience. But we don't have a lot of people in the healthcare, with a healthcare background in the legislature. So I really appreciate being there and being able to understand all of these issues and understanding what we need to do. So we need to treat addiction, we need to put best practices in place. I started to say we passed legislation to require that any treatment facility who receives taxpayer dollars has to abide by national best practice standards.
Okay.
Right.
And so that was House Bill 124. We also passed House Bill 148, which deals with the hospice agency's ability to destroy medications after someone is deceased. Now, I didn't realize, my mom just went through hospice, and we, as a family dealt with this, but when she passed, we had this house full of really strong narcotics that, if someone were in the business of diverting and abusing, it would be, a windfall for them. And so we need to be able to get the drugs off the street. So, by reducing prescriptions and prescribing, we are reducing the supply. By, destroying medications and educating folks about safe drug disposal and the importance of cleaning out your medicine cabinets. I will just say that is so important.
That's very important.
So many kids experiment and find drugs in their parents or grandparents or families' medicine cabinets, and we're unaware. We leave things in our medicine cabinets and we shouldn't. So, we have a lot of pieces that we're putting in place. Also, prevention and education is so crucial. And so we are taking a really hard look at how to prevent new addiction, and that's part of addressing who gets prescriptions as well, but talking to kids early and about the science, not just saying just say no, or making a judgment about those people who end up addicted.
Similar to a disease,
And the stigma of addiction is something that is it really cripples people and their ability to get help.
Well,
if they don't feel like they can talk about it.
That's right.
Yeah.
We dealt very positively with the AIDS situation years ago. June, being an LSW, licensed social worker, she was the first AIDS coordinator for all of Northern Kentucky with the Northern Kentucky Health District, and had something like 90 clients at the time, and it was overwhelming. But if you look and see how we nationally and statewide dealt with that issue, we found research, we jumped in, and it has been under control.
Changed. It has changed the way we treat.
The way we treat it and how we treat it. The same thing needs to be done with the opioids and the other drug addictions. Be proactive. Jen will tell you, I've helped out a lot of people and worked with a lot of people that's into this thing, and it's a difficult thing because
it's a long-term
it's a mind,
potentially fatal disease.
Yes, it is, very. And it takes over your whole brain.
It does.
You have to be very understanding, and it's great that we have you in the legislature there to point those things out to people who have never dealt with this sort of thing.
To continue educating, right.
Yeah.
We, in the budget, funded social workers with an additional $10 million.
Oh, wow.
So just understanding, to your point, the need for
who really were deserving. Talking Milton Maines the other night. We got a couple of minutes to go here in our show, and I got so excited.
We're just getting
now, you had to tell Dr. Moser that I know he couldn't make it because he's at the hospital.
I know.
That we do love him.
Well, thank you. Thank you. I do
Keep
too.
him alive.
Keep me alive.
Well, yeah, I like to say he's stamping out disease and saving lives.
That's right. And
well, Kim, we would love to have you come back again. It would be great if you could periodically pop in and just keep us up to date on what's going on in Frankfurt. That would be really, really nice.
Yeah.
This has been really
you.
informative to me.
Well,
But for us both, teachers to us are so important, next to
Yes.
God, family, teachers are next,
Mhm.
because they're the people that touch our children's lives.
It's so true.
Absolutely.
It's so true. Yeah.
And,
Mhm.
And then healthcare people like nurses and
That's
doctors.
right.
And social workers.
I know.
and,
We're a
You
good
wanna
team.
wrap us up there, mister?
as you can see, I've lost control of this
He's
show.
lost control.
But
We'll stop talking.
I am really thrilled that, we had this opportunity with Ryan and Roger and Spectrum, and I look forward to having all the judges on. And you teachers and superintendents out there, our email address has my phone number in it. We can put that on at the credits. We are not allowed to put phone numbers on, but that the email address is small j, small s, 750-0000@gmail.com. So you can send me an email if you'd like to be on the show. We'd like to have some of the superintendents and some of the teachers. You know, I received an award from the Kentucky Education Association in 1975 as the outstanding citizen in the state promoting public education. Not just as a teacher, because I left the teaching profession to help teachers. And I'm proud of what Gil Hammond and I did to get teacher salaries to where they are today. And I have no teacher retirement,
All right,
because I was one of those that have less than 10 years.
okay.
But we gotta close off
And I
here.
wanna thank you for
Thank
being
Kim
our
Moser.
guest
Sure,
today, it's
thank
been
you
so
wonderful.
much. This has been so much fun. I really appreciate the opportunity. And
Yeah.
of course, your support.
Well, we love you and we care for you and we care for the citizens of Kentucky, in particular Northern Kentucky. So this is John Stevenson and June Guyman Stevenson, the smartest move I ever made, by the
That's
way.
right.
And Kimberly
Love them.
Poore Moser, tell Doc I said hello.
I will do
And
that.
happy Mother's Day to all of you
Happy
mothers,
Mother's Day.
whether
Happy
you have
Mother's
your
Day.
own children or love other children, you are a mother, so happy Mother's Day.
And always respect your mother. Show great respect to your mothers. That's very important that you do that. So God bless you and thank you and for having us into your homes. And just remember, are you ready? Where have you been? Where are you going? What are you seeking? Are you ready? Kim Moser is ready.
I'm ready.
She's ready for the Lord and ready to tackle the issues. Amen.
Amen.
Thank you.
Boom.
All right.
Good
Nice.
job.
Aw, thank you so
You're a
much. You make it
natural.
easy. You make it so easy.
Hang on a
I
second.
love conversational.
Can I turn this
And that's
thing
what
off?
this is about,
Yeah,
you know,
right.
it's real.
it is real.
So that's
And
what-
it's- Yeah.
I got my
Oh,
microphone on still.
you're doing the, you're wired, hon.
I'm wired.
Oh, well,
Thanks,
thank you.
Ryan.
This is so wonderful.
No, seriously, it'd be great for you to come back.
I'd be
and
happy
do
to,
that again,
yeah.
because
There's so many things we didn't
that's
get
what
to.
I mean, there's a
Mhm.
lot of things going on
Yeah.
that, you know,
I think
without
it's interesting to.
hard copy
propose.
papers anymore, a lot of
Yeah.
people just don't
Mm.
stay on top of things.
I know,
So-
it's true.